Okay. All right, guys, we are back again with Skelly. He's really helping us out today with our shoulder anatomy and helping people to learn about regenerative medicine. So, um, another common injury that people experience within the shoulder. So, again, we have our humerus with the shaft and the humeral head, and it's going to get stabilized within this cavity called the glenoid cavity. And another structure which is really important is our attachment of the biceps tendon to the labrum. We made a previous video on the labrum, so let's talk now about one of the other injuries that can happen with this structure. So our biceps lies right here on our humerus, and then it's going to attach via two attachments. One attachment is going to come up and attach on the coracoid process, and then another attachment is going to come up through this groove. This groove is called the intertubercular groove, and it runs between the greater tuberosity and the lesser tuberosity. And as this connective tissue structure runs up through this groove, it's going to wrap around and attach to the top of the labrum. And this specific attachment is a point of weakness sometimes, where people can develop something called a SLAP lesion, or a superior labrum anterior to posterior tear. And what that means, we have 4 different types, and we'll make a separate video on those different types. But what that means is that this attachment of this tendon, as it wraps up and around to the top of the labrum, can actually be torn and start to degrade. It can happen through a variety of different mechanisms, but it's important that once that process happens, that you assess it properly and then implement a good treatment to try to restore the structural integrity in that complex.